Welcome to the VOALA Adult ASI Questionnaire Part 2, Medical Status and Drug and Alcohol Use webinar. Before beginning the 6 main sections of the ASI, there's general information that must first be collected. First, enter the date of interview. This is used to track the time between the interview and admission. Then, enter the time begun. This is used to track the length of interviews. Some interviews that take longer than expected may indicate a difficult client, one who is cognitively challenged, or one with a chronic medical or psychiatric illness. If you started the interview at 2:15 p.m., then you would input 2 for time begun hour and 15 for time begun minutes. Lastly, you would choose p.m. from the pick list for time begun a.m. or p.m. For the next 2 questions, you will select and input the information of who referred the client to your program. The next question is, how long have you lived in your previous residence before entering the program? This is used to evaluate the stability of the client's living situation. Enter the amount of years and months the client has resided at his or her previous residence. The question after that is asking if the client has been in a controlled environment in the past 30 days. This is to record whether or not the client has had restricted access to drugs or alcohol in the past month. A controlled environment will refer to a living situation in which the subject was restricted in his freedom of movement and theoretically does not have access to alcohol and drugs. This usually means residential status in a treatment setting or jail. A halfway house is generally not a controlled environment. Record the type of controlled environment and the number of days spent from 0 to 30. Once you are done with filling out the general information, you're now ready to tackle the 6 sections in the ASI assessment. The medical status section is the first section to be filled out. This section of the ASI helps you to gather some basic information about your patient's medical history. It addresses information about lifetime hospitalizations, long-term medical problems, and recent physical ailments. The first question is M1 and it asks, how many times in your life have you been hospitalized for medical problems? Include ODs, which are overdoses, and DTs, which are delirium tremens, but exclude detox, alcohol, drug, psychiatric treatment, and normal childbirth. Question M3 is, do you have any chronic medical problems which continue to interfere with your life? A chronic condition is a serious or potentially serious physical or medical condition that requires continuous or regular care on the part of the patient. For example, medication, dietary restrictions, inability to take part in or perform normal activities. Some examples of chronic conditions are hypertension, diabetes, epilepsy, and physical handicaps. Question M4 is, are you taking any prescribed medication on a regular basis for a physical problem? If yes, click the Add button to enter the name and purpose of the medication. Question M6 is, how many days have you experienced medical problems in the past 30 days? Include the flu, colds, and injuries. Also include serious ailments related to drugs or alcohol, which would continue even if the patient was abstinent. For example, cirrhosis of the liver, HIV, or HPV abscess from needles. Question M7 and M8 is based on the patient rating scale. These questions are meant to record the patient's feelings about how bothersome the previous mentioned physical ailments have been in the last month and how interested they would be in receiving additional treatment. Be sure to have the patient restrict his or her response to those problems counted in the previous question. Be sure to cross-check M7 and M8 with question M6. If M6 is 0 days, then M7 and M8 must also equal 0 because there are no medical problems experienced in the past 30 days. Question M9 through M11 is the interviewer rating. Rate and select the appropriate answer. For the comments area, remember to label the comments with the appropriate question number. The section after the medical status section is the drug and alcohol use section. This section of the ASI helps you to gather some basic information about the patient's substance abuse history. It addresses information about current and lifetime substance abuse, periods of abstinence, treatment episodes, and financial burden of substance abuse. For questions D1 through D12, refer to the 2 time periods, the past 30 days and lifetime usage. Please note that lifetime usage refers to years that consisted of extended periods of regular use. Regular use consists of 3 or more per week, binges, and problematic irregular use. For example, you can ask, how many years in your lifetime have you regularly used heroin? If the client replies that he or she has used it regularly since the age of 15 and the client is currently 21 years old, then for lifetime usage you will input 7 years. Another example is that the client had cocaine binges at ages 21 through 23, relapsed, and used during the summer when he or she was 25. The lifetime usage will be 4 years. The route of administration will also have to be documented for questions D1 through D13. Only select NA if the client never used that drug before. If the client has used a drug before, this is how you will code for these questions. Oral includes anything swallowed, usually in pill or capsule form. Nasal includes any other subcutaneous membrane administration, such as acid absorbed in the eye, sublingual administration of pills, or alcohol and other drugs absorbed through rectal tissue. Smoking includes inhalation of any kind, while non-IV injections include skin popping or intramuscular injections. Lastly, IV injections are injections directly into a vein. In cases where 2 or more routes are routinely used, select the most serious route that should be coded. The routes listed are from least severe to most severe. Question D2 pertains to alcohol usage to intoxication. This does not necessarily mean drunk. As a rule, 3 or more drinks in one sitting or 5 or more drinks in one day is coded under intoxication to designate heavy drinking. Be sure to use words such as to where you felt the effects or got buzzed instead of intoxication. Question D3 through D13 refers to commonly used drugs. Go over this table to know how to categorize each substance. Also, as a note, some designer drugs or synthetic drugs are not made in pharmaceutical companies and can include more than one type of active drug. For example, ecstasy may include a combination of amphetamines and hallucinogenic ingredients. In these cases, code this use in both categories. Question D15 states, how long was your last period of voluntary abstinence from this major substance? Most recent sobriety lasting at least a month counts. Periods of hospitalization or incarceration do not count. Lastly, periods of antabuse, methadone, or naltrexone use do not count either. If D15 is coded as 00 or if client is still abstinent, enter 00 for question D16. Question D17 asks, how many times have you had alcohol DTs? DTs are delirium treatments. This question is to record information about use of alcohol heavy enough to cause alcohol DTs. Delirium treatments occur 24 to 48 hours after a person's last drink. They consist of tremens, which are shaking, and delirium, which are severe disorientation. They are often accompanied by a fever. There are sometimes, but not always, hallucinations. True delirium tremens are usually so serious that they require some type of medical care or outside intervention. Delirium tremens are not to be confused with the shakes, which occur about 6 hours after alcohol has been withdrawn and do not include delirium. More than 5 delirium tremens are highly unlikely per person in a lifetime. For question D19 and D20, how many times in your life have you been treated for alcohol or drug use? Be sure to include detoxification, halfway houses, in or outpatient counseling, and AA meetings if there were 3 or more meetings within a 1-month period. Also note, if question D19 or D20 is 00, then D21 and D22 will also be 00 respectively. Question D23 and D24, it states, how much would you say you spent during the past 30 days on alcohol or drugs? Only count actual money spent. These questions are used primarily as a measure of financial burden and not amount of use. If you probed sufficiently during the previous questions, then you should have information about the amount of money that the patient spends daily on each substance. For question E17, it states, how much money did you receive from illegal sources in the past 30 days? This includes any money obtained illegally from drug dealing, stealing, selling, stolen goods, or illicit gambling. If the client has received drugs or other items in exchange for illegal activities, do not count the estimated cash value of these items. Simply note this in the comments section here and again in the legal section. Again, the focus is on cash available to the patient, not an estimate of the patient's net worth. For question D26 and D27, it states, how many days in the past 30 days have you experienced alcohol or drug problems? Make sure to include cravings, withdrawal symptoms, disturbing effects of use, or wanting to stop and being unable to. This is the end of part 2 of the VOALA ASI questionnaire webinar. You are now ready to watch part 3, the last webinar about the adult ASI questionnaire.